Hi there, you're welcome to Damien RX Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at Damien RX Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at Damien RX Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. So we're going to go ahead and talk about today's topic. So today's medication is known as Fioricet. So Fioricet is a medication that contains butalbital. It contains Tylenol as well as caffeine. So that would be butalbital, acetaminophen, as well as caffeine. So Fioricet is also a medication that's used to treat patients that have tension type headache or muscular headaches. So for patients who are feeling this kind of headache, the doctor will usually prescribe this medication for them to take it as needed in order to help with this headache, which can also come in form of a migraine, in order to help treat those patients in that time being when they're feeling that headache. So it's only used as needed when patients are feeling the headache. So this dose of this medication usually comes in about 50 milligram of the butalbital, as well as 300 milligram or 325 milligram of the acetaminophen, which is the Tylenol, as well as 40 milligram of the caffeine. So usually patients would take that about every 4 hours as needed for their headache, and usually the maximum is 6 tablets a day. So you want to keep this medication to a maximum of 6 tablets. If you've taken 6 tablets and you're still feeling the pain, usually since it's every 4 hours, that 6 tablets should last you for about 24 hours. And if this is still an ongoing headache, then you want to make sure that you're reaching out to your doctor if it's not working as prescribed. So let's dive right into the side effect of this medication. So the side effect of this medication include abdominal pain. It can also cause nausea and vomiting, as well as dizziness. Some patients notice lightheadedness while taking this medication. It can make them sleepy, as well as cause shortness of breath. So these are common side effects that have been reported by patients who are taking that medication. And if you start seeing them and it becomes very consistent and you don't like those side effects, then you want to discuss other options with your prescriber. So what are serious side effects that you definitely want to be reporting to your doctor immediately when you start seeing them? So some serious side effect of this medication is a feeling of intoxication. So some patients may feel like they're intoxicated while they're on this medication, and this is a serious side effect that you definitely want to bring up to your doctor when next you go for an appointment. That way, or making sure that you're reporting that as soon as possible to your doctor. That way they can see and make sure that this is a side effect from that medication, and kind of substitute that medication for another medication that works best without that side effect. Also, if you start this medication, you start noticing dark urine as well as pale stools. If you start noticing some loss of appetite while you're on this medication, or a severe stomach pain, as well as a cold and clammy skin, or any yellow eyes and yellow skin while you're on this medication, make sure that you're definitely reporting that to your doctor as soon as possible. This might be that your body is not tolerating the medication well, or there might be an underlying condition that the doctor needs to go ahead and diagnose you for, in order to make sure that you're taking the right medication and you're not noticing that serious side effect consistently while you're on this medication. All right, so what are other things that you need to know about this medication while you're on it? So this medication is known to kind of dull or decrease the mental function. So we do recommend that you avoid alcohol while you're taking this medication, as it can also really, increase the reduction in that brain function and kind of cause some dizziness and increase the side effect of the drowsiness feeling, or maybe the feeling of intoxication as well while patients are on this medication. Also, you want to make sure that you're avoiding other medication that might increase that sleepiness effect, like narcotics, maybe like some oxycodone, hydrocodone, those kind of medication in that class that can really drive up the drowsiness side effect of this medication. You definitely want to avoid. All right. And as for this medication, as I mentioned earlier, it does contain some Tylenol in there. So a regular general rule is that you don't want to take more than 4 grams of Tylenol. So 4 gram would be about 4,000 milligram of Tylenol. That is usually the maximum for the amount of Tylenol that you need a day. So if you're already taking the Butalbital and the Tylenol and the caffeine that comes in the Fioricet, you want to make sure that if you're taking an extra source of Tylenol, that you're not taking more than the recommended dose of Tylenol per day, which is going to be that 4,000 milligram tablet. Also, this medication is not for long-term use. Like I said, it's used only as needed when you're having those migraine headaches, which can come in form of like a muscular headache or a tension type headaches. That's when you want to use this medication. Also, this medication can be very habit forming. So most patients will become very dependent on the medication after taking it for a certain number of times. So you want to make sure that you're only, as I said, using this medication only as needed. I have heard some great feedback from patients using this medication, so it's definitely worth a try. Caffeine is definitely great for headache, as well as the Tylenol. The Butalbital just kind of drives the effect of both medication in terms of the brain function and helping that reduction in that headache that the patient is feeling. So make sure, like I said, to be only using this medication as needed, and it's not for recreational use. All right, I hope you were able to learn 1 or 2 things about how to use this medication appropriately, and also what to look out for while you're on this medication. As I said earlier, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. And also, we have a video on secret remedies on how to kind of improve the number of headaches that you're having per month. Make sure you check that out in one of our videos. I'm going to post the link in this video, so watch out on any side of the screen, most likely on the upper side for that video. All right, thank you and stay blessed.